Dr. Nyberg, I think sometimes you have pregnant patients who ask you, there's no history of birth defects in my family, why should I have tests during my pregnancy?
Well, that's a good question. Fortunately, 98% of all pregnancies are normal. So if you don't do anything, there's a 98% chance everything will be fine. But there is a 2% chance of some sort of birth defect. Most are minor, but some are major. And of the major kind of abnormalities that we can see, I would categorize them as one as sort of structural defects like heart defects and defects affecting certain organs. And the other big one is chromosome abnormalities, things like Down syndrome. And we can test for both of those. We know that these things happen with a certain frequency in the population, but we don't know which individuals are going to be affected. The family history has really very little to do with that. Every new pregnancy is a new experiment in life, so every one is different. The prior history or even the individual family history has very little impact on that particular pregnancy. We do take that into consideration, but most of those factors don't really help us at all. Right. So we have to take every new pregnancy as a new event.
Mm-hmm. And if a woman has a history of either miscarriages, or if there has been something in a previous pregnancy that was identified as chromosome abnormality, does that mean she should really be tested?
Well, prior miscarriages don't really increase the risk for the kinds of chromosome abnormalities we're looking for. So the first trimester pregnancy losses before 10 weeks usually are due to chromosome abnormalities, but there are major ones that are not compatible with even existence beyond 10 weeks. The ones we're looking for are ones that would survive to birth. So things like right. Down syndrome, trisomy 21. Okay. So prior history of miscarriage is obviously quite common. That doesn't increase the risk for that patient.
Does the maternal age increase the risk of chromosome abnormalities?
Well, definitely maternal age increases the risk for both miscarriage and for chromosome abnormalities that persist to birth. And we've known that for a long time.
So you would recommend it more as a woman ages? Or?
Well, the risk definitely increases, but recognize that all women are at risk. It's just the risk is less when they're younger. But the risk does rise really kind of exponentially, especially after the age of 40, and certainly, after the age of 35, but even more so after the age of 40.
Okay. And what are the most common tests you would recommend? Obviously, the 12-week scan, and there are now some blood tests that can be done.
Well, there's, I know testing can sometimes be confusing, but really there's two types of tests that are performed, and that's ultrasound or some kind of ultrasound and some kind of blood test. And the blood tests that are offered now, there's several. We offer a spectrum of blood tests here at the clinic, and those can specifically look for chromosome abnormalities like Down syndrome.
Right, but that doesn't mean you shouldn't continue to have your regular ultrasound scans throughout the pregnancy.
Well, you should have your regular scans and other kinds of testing that you'll have during the pregnancy as recommended. It's the 12 weeks period of time is a very good time to look specifically for chromosome abnormalities. Mm-hmm.
And then the next big one is, or scan, is the 20-week, which spots what sort of problems?
Right. Well, the 20-week scan really takes a good look at baby head to toe, and it's really a very thorough examination. We can look at even things on the inside that are not apparent at birth, just looking at the baby. Right. So it's really a very thorough examination. We're oftentimes asked what's different about the ultrasound here at the clinic compared to the exam that they could get elsewhere. And I know the NHS does a very good job, but they are limited on time and resources, and we take great individual care and much more time for each patient. So really very thorough. We're very fortunate to have Kira McKenna, who I consider to be the best sonographer in the UK. Really good, but also really, really good with people. Mm-hmm. So great individual attention, But also, of course, getting the 3D scans and all the images. But the detail and attention and time is really, you just can't get anywhere else.
And that gives the patient the opportunity of asking questions and getting reassurance if they need that.
Yeah, certainly. And it's the reassurance is fantastic. It's nice to get a blood result test that's normal, but it's quite different to actually see your baby and see it there, and obviously see all the details. It's incredible.
Yes. Dr. Nyberg, thank you very much.
Thank you.